for other professional providers as well, as you have that strict accreditation requirement.
Yes.
Thank you. This time I'd like to recognize the gentleman from Florida, Mr. Rooney.
Thank you, Mr.
For 5
Chairman.
minutes.
Thank you, Mr. Chairman. Mr. Secretary, I just want to feed off of something that Congressman Jolly was talking about. You had said that there are 600, you reduced the claims backlog from 675 to around 82,000, but now that there's approximately 400,000 appeals pending. I was recently speaking to the Florida VFW officials as well as Florida American Legion personnel, and one of the things that they expressed to me was that one of the problems is that the VA has moved personnel from the claims division to or from the appeals division to the claims to reduce the backlog in claims, but then that has increased the appeals backlog. So we've just, instead of trying to solve the problem, we've shifted that. And I said, well, why is that so? And it's because we have too many managers or supervisors or people in pseudo leadership positions in the VA as opposed to actual just worker bees to knock out these claims. Now, is that true in your opinion?
In my opinion, that's a red herring. I'll ask Danny to talk more about moving people, but let me put some facts on the table. 10 to 11% of veterans appeal. So because we've gone from 950,000 claims a year to 1.6 million claims a year, the absolute number gets bigger. Of those 10 and 11%, 2 percentage points, so 2%, create 45% of the appeals. So you have 2% of the veterans creating 45% of the work on appeals, and many of these appeals, as I said in my opening statement, have gone on for 25 years, 27 years, 29 years. It's just, it's unfortunate that 2%, and the majority of those 2% are already getting a disability payment and are already rated totally disabled. Mm-hmm. So, you know, we have an issue. We've got to deal with it, and that's why we're getting together next week. But Danny, if you move people,
just if I could, just on that, if you feel like one of the things that we've talked about with you over the course of your tenure has been sort of hierarchy on your staff. Do you feel like the things that the VFW officials were telling me are accurate or inaccurate as far as you being able to sort of put the chain of command that you think works most efficiently for that organization, as opposed to, you know, getting stuck with the way that it's been and not being able to move the wheel?
Yeah, 10 of my 16 direct reports are new since I've been confirmed. Everybody at this table but me wasn't here last year to testify. Ron was on staff, but at a different level. Danny is the new leader of VBA. He's already made changes. I think you changed the chief of staff, if I'm not mistaken.
A new deputy.
New deputy, I mean, yeah. But could you talk about moving the people?
Yes, we have new deputy, new chief of field operations, and we're looking at the entire staff in the headquarters to move people around to positions where they're better suited right now.
Well, I'm not talking about moving around. I'm talking about if you've got a bunch of people that are supervisors or managers, and then, you know, they're all sort of telling each other that they don't have to do the work because they're in charge. And then you've got like 2 people there that are actually knocking out claims or figuring out what the appeals are. I got the sense from talking to these officials in Florida that the VA is still top-heavy rather than using the money and the resources that we appropriate to have personnel there that are better suited to just knock these claims out.
No, we have the right people doing claims. As a matter of fact, we're probably just the opposite. We put everybody on claims last year, from the highest person in the RO director, down to people that were sweeping floors. If they could help with claims, everybody was doing claims. Your question about did I move people off appeals? Yes, we did last year. We moved some of the people off of appeals and put them on claims. But even with that, I did 30% more appeals last year than we ever did before in our history. We did more appeals. Those people are all back now because we have our automation system in place, and it's working. So they're back on appeals. And last week, I directed $10 million only for overtime for people in appeals, to get them on the appeals process.
Okay, I have to cut you off because I have 10 seconds. If I could just ask another question before Charlie gavels me down. I'm very sensitive towards my time. We also talked about with PTSD and TBI. We have some of the people that have come to see me and some of my constituents said one of the problems with the VA is that we are treating potential suicidal veterans with social workers. Not that there's anything wrong with social workers. I worked with plenty of them in a previous life. But when you deal with somebody that is potentially suicidal, and whether they are given a prescription from a therapist or being told to see a social worker versus going to see a psychotherapist or a psychologist, how do you kind of put who you diagnose with somebody who's potentially suicidal with the person that's most likely going to give them the help that they need?
Yeah, very briefly, excellent question. The field of mental health actually is a team-based approach. So there is a triage assessment, a risk assessment, and the higher level, the higher severity patients are assigned to psychiatrists, and then there are psychologists and social workers that are part of the team as well. So higher risks, a suicidal patient should be under the care of the most advanced level practitioner, the physician.